Hello everyone, dear friends. The Prince and I are on our channel. Today someone came to us. Her name is...
This is Valeria.
Yes, Valeria. It's very nice to meet you. Let me remind our viewers who are visiting our channel for the first time. We have a medical channel. We work on the treatment of the motor apparatus and much more. So now we are going to show you manual therapy techniques. It's possible that we'll also include some physiotherapy in today's broadcast. I'm not sure which kind yet, and maybe a bit of therapeutic exercise. It all depends on what our patients complain about today. Well, of course, we talked a little off camera, as I always mention, and I'll say it again now. Valeria, tell us what's bothering you. Okay.
My hands are bothering me. They hurt from time to time. This area right here, and sometimes it hurts to bend them. When I try to bend my hands strongly like this, it doesn't bend well, and it hurts here. That's it. Because I have a sedentary job, my back also gets tired from time to time, even though I try to sit up straight. But in any case, I feel heaviness around my shoulder blades and in my lower back. My foot clicks.
Where exactly?
Right here, this spot. Sometimes I honestly and truly feel a very strong, overwhelming need to finally crack it open. Without it, I can't fall asleep there, for example. That just doesn't work.
And it gets easier.
It'll get easier.
Blocked, then released.
Yes, yes. That's it. I also get headaches from time to time. And I also feel this persistent headache spreading down into my neck. It's like it's incredibly tense, and I really want to knead it. Press firmly on it and basically just give it a deep massage. So that's basically everything.
Have you had headaches often?
At the moment, no. Fortunately.
So right now, that's the situation.
Well, over the course of the last few months, I haven't really felt it as much. But whenever I find myself feeling stressed, of course, it starts to hurt. If I didn't get enough sleep or slept badly, didn't sleep well, then my neck can also hurt in the morning right away.
So you showed everything, right? The wrist joint, then the area around the shin, correct?
Yes, that's right.
Are you generally flexible in your joints?
Well, I think so. But how do you tell?
Well, for example, can your finger bend all the way down?
All the way. No, but...
Has it bent fully?
No?
Can you do it like this?
Well, with this hand, actually. With this hand, I can do it easily. But with this hand, it already starts to hurt. Right in this spot.
Basically, everything is different here. Let me explain it again. We have, so to speak, mobile joints and non-mobile ones, active and inactive. They can be called and interpreted in different ways. A common example, I move my fingers, the joint is active and mobile. The skull. Our skull also consists, roughly speaking, of joints, connections, bones. But it isn't considered as such. There are some micro-movements, but visually a person doesn't notice or pay attention to them. So, well, can you move just your forehead separately? No, that's not what I mean.
Yes, I used to be able to.
That's different. That's you just moving your skin, roughly speaking.
Ah, well then no.
No, that's something else. Right now we're talking about, you see, we were talking about...
The entire joint.
So the point is something else. Once again, you're sitting at the computer. Are you left-handed or right-handed?
Right-handed.
But it's your left hand.
Left hand, yes. Before coming here, I was thinking about what could be causing this. I think it's a school injury. At school, they told me it was just a sprain, so they just wrapped it with an elastic bandage and that was it.
All right. I thought you were joking. Was that off camera just now?
No, it's true. The boys pushed me. The boys?
The boys?
Yes. Well, that's the kind of boys we had at school. And I fell, and I bent my arm so badly that it hurt afterwards.
There was pressure.
Yes, it hurts on and off. Sometimes it does, sometimes not. Back then.
You fell down hard, slowly got back up, eventually figured things out, and your wrist really hurt.
It hurt, and they told me to wear an elastic bandage, to walk around with an elastic bandage.
Tell me, did you already put something cold on it?
No. Swelling.
Was there?
Yes, there was a little.
Bruising?
Yes. I have rather sensitive skin, so yes, there was bruising, there was swelling, it was a bit painful to move, but I don't think it was a fracture, even though so much time has passed.
A fracture, how should I put it? People ask this question, is it a fracture or not? I'm not talking about your specific situation right now, but in general, patients come in, they have some discomfort. They fell and then discomfort appeared. A fracture is easy to recognize. There are several types. We can see it, for example, when it's an open fracture with displacement, and there are also many different types of fractures. Honestly, I don't remember all of them anymore, but you can see spiral fractures, some with displacement. It's all clear. Basically, there are different fractures with their own names. This is more the domain of a traumatologist or orthopedic specialist. If it were a fracture, it would be simple and obvious. There would be pain. And the kind of pain that would change everything. All right, so what about the leg?
Nothing has ever happened to my leg, it's just that I can't even say when it started, but I began to feel the need to twist my leg and make it crack. And it's both feet.
Does it come with any pain?
There's no pain.
All right, cervical spine. When does the discomfort start to appear more? And what do you do about it?
After a long workday, discomfort can appear. If I have a headache, it always radiates to my neck. Maybe I sleep badly or put my head in the wrong position. That can also make me wake up. What do I do? Well, if I have a headache, I just take something for it.
Do you play any sports?
No, but I dance at home quite often. I go for walks a lot, especially now.
You dance at home?
Well, yes, to music. Elisa plays some music and off I go.
I see. All right, let's say so. All right, by the way, write in the comments if any of you dance at home. And if someone above you is making noise with music, then guess who that is, as they say, all right. Basically, there are no more questions left. That's it, no more questions.
No.
Well, great. Now we're going to have a laser diagnosis. We'll measure your height and also your weight. Just kidding. How much do you weigh?
54.
And your height?
1 meter 58.
There's this thing with girls. When they tell me their height, it's lower, and when they tell me their weight, it's higher. Somehow that doesn't quite add up. Well, all right, it's not like we're here to check that. We have our own method. We, so to speak, observe the dynamics. Our patient gets taller with the weight. There are these rumors going around that nerves eat away at you, and plus you'll sweat a little bit. Well then, buzz, as they say. Let's get started. Where shall we begin? Which area do you want to start with?
I don't know, you decide for me.
I'll decide myself. All right, then we'll start from the other side. Now look at me. Please give me your right hand, then your left leg, and just try your best to relax completely. Go ahead and turn your head completely in the opposite direction. Just like this.
Goes here.
This goes here, this goes there. Well then. Bonjour, as they say. All right. And more. Good, well done. Put your arms along your sides. And can he rub?
Against it?
He can. Turn over onto your back. You can, but it's inappropriate. Yes, now we need to.
But sometimes you just want it to fly out, you know? Well, more precisely,
Well, if you want to.
you can't really control it in some situations.
Put it on. And now, we are going to move right on to the shoulder joint and the shoulder blades, as well as the thoracic region. You might be asking yourself, how is that even possible? Well, now you're going to see just how this ordinary rope actually functions.
This is...
Pure.
It is a real beauty. It is securely tied right here. You can easily position it however you like.
We'll set that aside for the time being. Are you feeling ready to begin?
It's like cracking, right? There are people who like to hear it up close. The crackling sound.
I don't know, but our job is to show the viewers that we're actually doing something. And I always say that the crackling isn't an indicator, even when you reach a certain level. That is, you can feel how the joint moves. And if it moves again, then basically we don't mess with it. Now, to understand whether it's normal or not, first of all, I've already determined that by palpation, and secondly, we're going to work through it now. Relax. I'm pulling it back. About the sound, I'll say it right away, and I apologize for the sound. But it's impossible to control everything like that. But my task right now with the patient, as you decided, is to make a quick adjustment. I placed my hand under the transverse processes. Is there something wrong at the moment?
I just took a breath.
What happened?
It was involuntary.
What happened?
I don't know. Deep somewhere inside, I felt a distinct crunch.
Well, that's good. Now, basically, it's the same thing, but on the right side. But can you hold your hand now?
I can.
All right then, and I'll raise it up just a little bit higher. Hold it. Sit down.
But I can't describe what happened, just that something good happened there.
But it did not go exactly as planned.
Now I really want to stretch, right? Every single muscle.
Move toward my side. Now please turn onto your side, bend your arm comfortably under your head, near the microphone, and apparently, since you are unable to describe it yourself, I will be the one responsible for describing the thread in detail.
All right then, that sounds good to me.
You did everything exactly right, almost as if you watched all of our videos. The other side.
Just...
Now slowly turn it over. Once more. I was wondering if you could please move just a little bit closer to me. No, everything was correct. Don't arch your lower back. On the contrary, I round my back slightly forward. Come on, lie on your side and move closer to me. Personally. Now, as you can see, I round my back a little, no arching, lessons learned. Sit up. Facing the viewers. Like this. Now, let's just say for a moment that we're actually going to get in here. Well, then we shall proceed with God's help, shall we? Now we will perform a manipulation. I will pull the first rib and mobilize the cervical spine. The patient's task is to relax. Yes, you heard that. So, of course, we also have to address the left side of the neck as well. We certainly can't do without treating both sides equally. I am also going to apply a steady amount of pressure directly to the specific area of the scalene muscles right here. Can you feel that sensation as I press down? And then I will slowly begin to pull and stretch the tissue. Downward. To be clever, I wanted to. Well, all right, you might say, so what now? Now we lie on our stomach. Rest your head on your chin. And relax really well. Right now, at this very moment, I am actually pulling it once again, right here. That's really the only way to describe it. Turn over onto your back. Shall we continue?
Yeah.
If we do it, let's do it right.
Well, go for a swim.
Next. We also have a number of vertebrae. Through the place, but without pressure. All right, that is fine. Let him go. I completely understand how you feel. It might feel a little bit scary at first, but it is all perfectly normal and okay. Everything is fine. Sheaf is fine. Everything is fine, don't worry. Should I climb further? Well, homeostasis. Well, let the patient remain in euphoria for now. Our very own... Well, you see, what do you feel in your palm? They're sweaty, you feel it, everything increased. So, right now we won't do it yet, later. We'll do it for you before compression, okay? Now we'll call everyone and do everything before compression, after which we'll move on from decompression. Are you familiar with pre-compression? But you haven't watched the video? All right. So, you came here based on a recommendation, right?
Yes, the operator recommended it to me.
All right. Let's move on to decompression. Well then... So we're basically all ready now.
Subscribe to find out if I survive.
Lift your head up, then lower it.
I'm already scared. That's it, that's it, that's it.
All right, don't be scared anymore. Well, we don't have a cat, but we do have... The operator doesn't purr. Really hang in there. Wait a second. That is actually a false start.
Oh.
Wait, just wait a second. There. Now that's some emotion. So, did you like lying there? Can you get up now? So tell us about it.
Honestly, it's an absolutely impossible feeling to describe.
Empty.
Yeah. It's both painful and not painful. To be honest, right now I feel... Well, I'm still experiencing a little bit of lingering pain, I guess.
Discomfort.
In my back.
It will pass soon.
Right? But... Well, I'm waiting for it to pass.
All right, good. So for now, we'll move on to the lower limbs. We'll wait until it passes. We'll start with the lower limbs. Let's even start with the hip joint. Your task is just to relax. All right. Did you feel that? Everything's fine here. It really is wonderful being here today, so if I understand correctly, it is specifically this exact part right here that consistently cracks for you, right?
Oh!
What was that?
It's okay, it cracked. And here, I think it even cracked before I pressed.
Excellent. Excellent. All right, the wrist. About the wrist. Initially, in general, when the patient described it, there was nothing to do here with manual therapy. Here, you just need to strengthen the wrist joint and avoid overloading it. There aren't really any such... Was it like this?
Like this, yes.
And like this?
No.
Look, I'm squeezing, and by doing so what happens is I'm stretching the joint. That is, I'm increasing the physical distance between the joints, gentle squeezing, and in this way the joint functions smoothly. There's absolutely no pressure on it. Of course, and it's not uncomfortable at all, but I'd like you to lie down on your stomach first. Just stretch yourself out comfortably on your stomach, resting on your elbows for a moment, as you will need to slowly roll onto your side. Yes, that is perfect. Right now we're going to work on the forehead to elbows movement, so just get up on your elbows and bring them a little bit further forward together. Keep your elbows right there. For those viewers who have just joined our channel, so to speak, and haven't visited it before, I'll explain why discomfort appears at all. In principle, during the process, it's usually short-lived. Secondly, it might not appear or manifest itself at all. But at this moment, it did appear, and most likely in the thoracic region, I suppose, right? During decompression.
Right here. In the thoracic
Region.
Yes, now it's already in the
Thoracic region, because when we stretch the spine, the healthy tissue is the first to be pulled. And it also pulls along. Well, imagine, for example, a ligament or a muscle. There is degeneration, there are some minor changes. When we stretch, the elastic mass is pulled. Which healthy part is being stretched? First of all, it grabs the affected area. And that's why there's discomfort. That is, with each subsequent time, the discomfort becomes less and less, and eventually it disappears altogether. Go ahead, please. So, as you can see, we had the entire left side.
Yes, the left hand.
All right, operator, you stepped away. We're coming to you now, too. Let's turn around properly. It was actually growing right here in this very spot for quite some time. Oh, yes, that's right. How do you know? Well, at this point, you can already guess what's going to happen. That's why we have to do all of this unexpectedly. Now you'll feel tingling, a slight
Stinging?
both hands.
It's like when you hit your
Elbow. By the way, you have correctly pointed out, it is right at the level where the vulnerable radial nerve passes. When we hit it, what do we usually hit it on? On a corner?
on the corner.
Of a table, yes. Yes, it's more or less similar, but less pleasant, I would say.
Yes, 100%.
100%. Try moving your hand at all.
Well, it's like on this particular side here, there is nothing at all up to some point. Right here in this hollow area.
Is it here? Yeah, I definitely got it. So let's sit down for a moment. Rejoice.
No, that's a funny name. Ultra Shock Master. But apparently I have nothing to rejoice about.
Give me your hand. Hold it. Now we're going to use physiotherapy equipment, a shockwave device. You'll need to bear with it for a bit. The impacts are delivered using sound waves. We need to break it up a little, get things moving. Right now, I am carefully setting the parameters to exactly 2 bar and 7 hertz.
Well, maybe my cats can do that. I don't know. How many hertz do they have?
You need to bear with it. God be with us. In this area? Yeah, okay.
Yeah, well, so
It looks like carpal tunnel syndrome, but no, it's just a strain. Good job. All right then. It is your turn now. Are you ready to go?
Mm-hmm.
Try to move it.
It doesn't hurt now.
Amazing, right?
Amazing, yeah. Better?
Excellent. Well, dear viewers, we are ready to move on to the final test. The patient is already warming up, so let's not keep you waiting. QR code, please. Just like that. There's also a hint above the video with the QR code. You need to follow the link where you can watch the full video. From start to finish. Well, let's get started. Let's sum things up. Well, first of all, you've leveled up for today. Give me 5. Congratulations on that. And secondly, say a few kind words, so to speak.
Well, I came here not knowing what to expect. All I had seen were those reels where people get cracked. They even crack dogs, yeah. Well, after all this, I feel lightness in my body, relaxed. Especially in my shoulder blades, it's a really nice feeling. Or maybe not so much relaxed. Maybe, on the contrary, I should work them out a bit. And finally, my wrist doesn't hurt anymore.
How long have you been living with that?
Well, since school, I don't know, maybe 10 to 15 years.
Well, jumping ahead a bit, sorry for interrupting. I just might forget later. It's not like you can just fix it in one go and be cured. You need to work on it here. So let's say that.
Yeah. Well, yes, it was an interesting experience. That's how it was.
Were you surprised by anything?
By everything. Well, I was scared to trust someone to crack my neck. For me, the cracking of the neck to one side or the other is associated with, in movies they show how someone's neck gets twisted and the person dies.
Yeah, people usually tell me it's like in American movies.
Yeah, that's right.
Well, in American movies, that's Hollywood. We, unfortunately or fortunately, are not in Hollywood. I don't know if it's better there or worse. If anyone from there is watching us, let us know. So let's do this. What did you like and what would you, well, kind of rather stay away from? For example, from me.
Well, as an experience, I liked everything. But of course, I didn't like feeling pain. When we were kneading the glutes, the decompression was also quite a bit of a shock for me personally, for me.
But we saw that together with you, and
other than that, in general, everything else was pretty tolerable.
well, that's great. So would you recommend it?
Yes, I would 100% recommend it.
You don't regret it. That's the most important thing. Thank you so much to everyone who watched until the end. And to those who left earlier too. I hope you'll let them know that I thank them for that. That they at least visited our channel. That's it. Valeria and I lifted you up. Can we lift you up? The audience isn't small, I'll say that right away. And
How?
how else? That's it. We lifted you up, gave you a hug, let you go, gave you a kiss, and let you go. A bit of tautology, but that's okay, as they say. So, until next time, there's more interesting stuff ahead. Goodbye, everyone.